right.
Well, good evening, good morning, good afternoon, wherever you are in the world, because we do have people that follow us all over the world. So, as you know, this is Dr. Jacqueline King, and you know that November is Diabetes Awareness Month. And so many of our people, African Americans, suffer with diabetes where they lose limbs, go on dialysis, and so much more. So we have the lovely Erica Hall with us today. She's the owner of Hall Diabetes Management Resource Center. And so, Erica, welcome. So glad
Hi.
you could join us. How are you?
I'm doing well. I'm glad I can join you.
Well, I'm excited because you have an extensive background in a lot of stuff. But what made you want to get into diabetes education?
Well, because as you know, I'm a nurse practitioner, and my area of expertise had been diabetes. So I was working on the management side. And what we know is that with management, that requires a lot of education when a person is diagnosed, prior to they being diagnosed, and pre-diabetes. And during regular visits, you don't really have the time to do that all the time. But lifestyle modifications are a key component in preventing diabetes and preventing complications. And so my passion is prevention. And so becoming a certified diabetes care and educational specialist, it was one way for me to be able to start and provide prevention in a timely manner with outside of clinical visits.
That's pretty awesome. Everyone that's tuning in, go ahead and let us know where you're tuning in from. Share the broadcast. So we're talking about diabetes, and so tell me exactly how it works. People find you. How do you find your clients, or how does that work?
So I have my for me it's like on a website, and because I am a certified diabetes education and care specialist, I am on their database list. And also by working with primary care providers and within my community and the community work that I do, they find me that way. So whether it's a health fair, in a church, in an assisted living facility, working with their activities director, finding myself and finding people where they are, where their need is one way that people find me. And also with the advertisement from my website, and primarily from the primary care providers and your renal doctors and all providers who really need someone to provide the education to patients.
Is this a nonprofit?
So no, I'm not a nonprofit. I am a for-profit, but I am working on getting a nonprofit wing because I want to do so much more within the community.
That's awesome. So you mentioned that you do go to job fair, health fairs. So you set up your table in health fairs and different states, or just you stay where pretty much where you are.
So pretty much here in Baltimore, in the Baltimore area, I actually had my own. I have my own health fairs. I invite others to come,
Mm.
organizations to come to my health fair. One, to put eyes on who I am and what I provide, and then also just providers like chefs come in to do preparations for healthy meals.
Mm.
I have a massage therapist because we know the whole body is very important in your mindfulness. So I have a massage therapy for relaxation. And I also have a personal trainer who comes in and that 30 minutes of day of 30 minutes per day of cardiovascular exercise, getting that heart pumping at least 30 minutes a day to start with some resistance exercises and what that looks like. So I also have a trainer who works with me as well. So when I have health fairs or if I go to a facility and provide this education, it is all encompassing.
That's awesome. People are starting to come in. Let us know where you're tuning in from, and make sure that you share the broadcast, because this is a very important topic, especially to African American. But we're not the only one that suffer from diabetes. So, do you do anything with the youth? Do you go into the schools and educate?
So not as of yet do I go into the schools, but I'm open to doing more with the youth because what we're finding, how diabetes previously was a disease of older age. Then we've seen it trickle down, even though the percentage is still highest in our patients who are 65 or greater, but that number is changing. Young people, and of course we know with the sedentary lifestyle, really can be a barrier. One of the, for a healthy, healthy lifestyles and options. And they're removing so many things out of the school. So I haven't crossed into the schools, but when I'm in the community health fairs in communities, children also are there. And so when we play music and they're dancing and they understand well, the music sounds good, we're moving, that is part of prevention. And when we have those in areas where there are food deserts, if I'm present there, and because you have to meet people where they are, that's all a part of education and what I provide and the group of people that I work with provide.
So do you find that because in the food deserts, a lot of the people are serving unhealthy foods, foods that are going to lead you to diabetes later on in life, McDonald's and French fries and all that stuff. Um, do you feel like because you're educating the parents that they will then educate their children or actually make healthier choices for the family? Or are you finding that?
So we're finding what's been encouraging if more people come. So we may, a couple of years ago have a health fair and a community fair where you have people just slowly trickling in, but you're seeing more people interested in other options. There are resources in the community where there are healthy foods that can be delivered or available for free through initiatives within the community. Again, I'm in Baltimore City, where my clinic is located and the communities that I serve and primarily serve. And those having those resources available when we have those fairs and demonstrating how you can eat healthier, even if on a budget. And of course, in a food desert, you spoke of McDonald's or some of the other fast food restaurants. Here in Baltimore, you have corner stores. And in some of these corner stores, these are the primary resources in some cases when you need to pick up something. And yes, we know that a lot of times there are unhealthy options. What I always like to do is meet people where they are and let's figure out how, when we walk into the corner store or when we do make the market run, how to make those choices the right choices. And so, yeah, I do believe when the parents, again, when we know better, in most cases we do better, in how to empowering the parents and the young adults on how to make the good choices and what those good choices will mean in the future when it comes to prevention of diabetes, or if diabetes is present, preventing further progression.
So are there signs like the kids, are there any signs that they could possibly become diabetics? What is the precursor for diabetes? I mean, I know a lot of it can be hereditary, but are there other signs like obesity and so on and so forth?
So you hit on a couple of things. You put you at a 50% increased risk of developing diabetes in your lifetime if you have a first degree relative. That means parent, a sibling with diabetes. And in this conversation, we're particularly talking about type 2 diabetes, not type 1. So type 2 diabetes, which one of the key components of that is insulin resistance. And what does that look like? Obesity. So having a child who's having excess weight, but also a sedentary lifestyle. You're not up, you're not moving. If you're not active in sports, and these things like we're on now, like technology really has limited the desire even to get up and move and move about. Even if so those are the things that could be precursors. You're not active, and then you add to the diet. Like if parents are busy, if foods are not planned, or even if you don't plan, having something available that you can grab, there's a better choice than some of the snacks that if you're grabbing them all day every day. And then I remember when I was in elementary school and that we had people in the kitchens cooking, in the cafeteria, they were cooking meals. And now you have processed foods coming from these big plants. And so you're really not getting the option. And you ask a child, they going through the line, if they're going to eat pizza or they're going to get the salad bar. 9 times out of 10, they're going to choose the pizza option. And so having those conversations with a family. So those precursors would be not moving, eating the foods that a lot of times are most readily available, which are not always the healthier ones, and not moving it much. Those are some of the signs and symptoms. And I mean, what we can see. And for parents, if you see the same things, the signs that you can see as an adult, if you see a child is drinking more lethargic, like tired a lot, they're going to the bathroom a lot, or we look not well, or even this quick weight loss that's not planned, because that means the blood sugars are really high and the body is doing what it needs to do. So using your fat for energy, and so you lose all this weight. You can see those things happen even in young people. Like I said, the percentage is lower in younger people, but it is present. And it's alarming how much that area is growing.
Wow. So do you partner with like churches to go and speak to the congregation? Because even though you're in that area, because of technology, you could be doing Zoom sessions or virtual sessions. So you don't have to just be limited to Baltimore.
That's exactly correct. So I am in talks with a few of the larger churches in Baltimore now to start doing some programming within the body, and it can include some Zoom work. My facility is a CDC certified diabetes prevention program center. So that means it's a program which does a full year of lifestyle modifications. You could have classes and all things to prevent the progression from prediabetes to diabetes. The precursor, you have prediabetes, but what I've opened mine up to people who are at high risk of developing diabetes. So those first degree relative with diabetes, or if you had gestational diabetes with diabetes during pregnancy, that also increases your risk of developing diabetes. So if that is who you are, then you would be able to be a part of the cohort of patients that we do classes. And I have an upcoming class coming late December, early January, where we'll start our next class, our next group.
Yeah, let's talk about gestational diabetes for a minute. African American women are a very high risk for gestational diabetes. Why is that?
So I would say African Americans are at higher risk for developing diabetes across the board, but in the case of the gestational diabetes, it depends. We look at I would say obesity, weight. You already coming in with some increased insulin resistance in the presence prior to becoming pregnant. And then you add the pregnancy, and in certain trimesters of the pregnancy, your insulin resistance will continue to increase. So it puts you at a higher risk of developing this gestational diabetes. And again, after the delivery, in some cases, the diabetes itself is eradicated. But although it's eradicated, that does put you at like a 40% increased risk of developing the diabetes in your lifetime.
40%. That's pretty
Yes.
high.
It is very high. So if you have that 40%, and then consider if you already have also the risk factors of family, the first degree relative, and then you also have the extra weight. Again, I use the weight as one key component, but if you're getting up and move, we know that just 7% decrease in the weight can prevent the progression to diabetes. And so you do the things you can change, you change, right? We can't change and choose our genes. We don't pick our parents and who and what we're connected to that way. But the things that we can change, we need to change, right?
Yeah. Well, I think that this is really great information. We have to educate.
Ex-
Knowledge is power. So I thank you for what you're doing. As far as the educational piece, more of it is needed because we know that a lot of people like you said with technology like to sit on the couch and watch TV or be on the phones or on the computers and all that, and so exercise is like the furthest thing from your mind because you just technology driven. But what are some of the things that you can do if you really don't like exercise? And I know you must know have some tricks and things that they can do, right?
yes. So everybody, I don't expect anyone to go run a marathon. at all. So give you an example. People say, I've been at work all day, I'm tired. The least thing I'm thinking about is moving. But are you going to turn on the TV? Are you going to get on your electronic, your phone, your iPad, or whatever? If you're looking at a show, each show has a number of commercials. If during each commercial you get up and walk in place, or you have a resistance band while you sit there looking at your show
Mm,
on your phone, you're getting some activity in. Now, am I saying that's enough? It's a start. Okay. It takes you time to make like this a pattern, a habit, but you start doing that and you adding that and you start saying, well, I'm feeling a little bit better. Or you go into the doctor and say, well, your numbers came down a little bit. What are you doing? And not only just the movement, and then you go from supersizing the drink to getting a small to not needing it at all, or you're placing it with water. Some simple moves to make to prevent progression to diabetes, or if you have diabetes, preventing complications of diabetes.
mm-hmm. Um, I have a big yard, so I do a lot of yard work.
Okay.
Unfortunately, I think that counts as exercise, right?
Yeah, that definitely counts. And you'll be what's surprising is I would have patients who happen to maybe be on insulin, or a type 1 patient who, when they garden, their glucose levels go down. Because gardening, a lot of times people say, oh, they're sitting around. You're really using different muscles in the gardening that you would normally use. And so that is considered exercising. But when I think of cardiovascular exercise, I do want to see the heart rate go up. So you want to do something. And it's fall now, it's getting a little brisk, but if you're in an area that's safe, and I always say that because everyone doesn't have the option to be in a neighborhood where it's safe to walk. So I have to keep that in mind. But if you're in an area that's safe to walk, if you have access to a track that is safe to walk, get buddy up and you go walk. And you try to make it a habit to do. Like Thanksgiving is coming. Okay. And so what
Soon.
what I always suggest is that look, the turkey go in. I don't know. Some people put that turkey in the night before. You're up all night. It's festive. It's a good time and it's a great time for most people, not everyone. I always like to put that disclaimer. But when the turkey's in the oven, and so how about do the morning walk when the turkey's in the oven, right? And then when you come back in and you get prepared the rest of the dinner, and when dinner depends if you what time of day you decide you're going to eat, then you go on a walk after that. Help the food digest. We know what's in the turkey that put you to sleep, but let's not feed into it.
You're funny. Yeah. So you and I really haven't had a long conversation. You probably don't know that I serve on the board of directors for a community harvest food bank here in Indiana,
Oh,
and we're partnered with well, actually, our Feeding America.
oh,
Uh,
wonderful.
yeah, we people can come to the agency. I am an agency. My nonprofit is an agency, and they can get food, healthy choices. They can get like as much vegetables as they want, and get healthy choices as well. So you and I hadn't talked about that, I don't believe, but
No,
yeah, we've been doing food deserts and food banks, my nonprofit, for 10 years.
that's
Just
wonderful.
trying to make sure that you know people don't have to go to bed at night hungry,
Yeah,
children, families,
so true.
because things, even though the pandemic seemingly is slowed down, because it's definitely not over, um, a lot of people are still struggling.
They
So
are.
we just want to do our part. But I thank you for everything that you're doing. You are definitely a blessing. Let the people know how they can reach you, and your website and all of that stuff.
So it's really simple. Like you said, my clinic name is Hall, Hall. You might hear Southern drawl, but it's Hall Diabetes Management and Resource Center. And to find me and just like that, you can find me on any of the social media platforms. And my website is halldiabetes.com.
That's easy enough. Erica, you have really been a blessing. Thank you so much for sharing what you do, and I thank you for caring, because it means a lot. It's if each one of us does something, anything, it's when we come together, it makes a big difference. But everybody can do something, right?
That's exactly right. Everybody can do something. And I always say, when you know better, our goal is to do better. And my goal is to educate and empower. So if I empower one person, that can empower our family to do better. And, generationally, you don't have to say, well, mom had it or grandma had it, so it's my lot. We change those generational pathways by making changes when you know.
Absolutely. Thank you so much for joining us today. We're going to have you back where we
Certainly.
talk about some other things. But thank everyone who has tuned in. Please share the broadcast. I did ask you to share where you are tuning in from, but make sure that you share the broadcast because it could very well bless someone else. And it's nothing but a click a button and hit share. Thank you so much. As I say, I love y'all. There's nothing you can do about it. I actually will be back at 7 with Joe Dudley Jr. from Dudley's Hair Products. Yeah, he's coming on because he's got some exciting news to share. And we're going to talk about leveling up, where he came from his mom. I interviewed his mom, and she told me that they started their business in their kitchen. A lot of people don't know that. It's a really nice story. And then they just kept going and going and going till they've got the Dudley Hair Products all over the world.
That's right.
God bless. And until 7 o'clock, come back.